I'm Sue Gole from the Cleveland Clinic Main Campus Pulmonary Department, and today we're going to go over the bronchoscopy competency. First, you're going to actually have to have the fellow will bring you the bronchoscopy cart. It looks like this. The bronchoscopy cart, first and foremost, needs to be plugged in, and along with the cart, they will bring you a bag that you will need to get yourself prepared. Two things to remember. You need to know what size ET tube you have for the patient. If the patient is an adult patient, you'll have a 2.8 size bronchoscopy scope, and it is inside this triangle. That is for a patient that has an ET tube over a size 8. If the patient has less than that, you'll be getting a pediatric scope. The pediatric scope is a 2.0 with a blue triangle. That is for a patient with an ET tube from a size 6 to a size 7.5. Once you have the scope determined, you will take the scope and you will plug it in. Keep it straight. It only goes in one way. First, it goes in to this, like this. You then need to turn on the on button here and the on button here, and the lamp also needs to go on. Once the lamp's on, you'll be able to test that you're able to see on your screen that the bronchoscopy scope is ready to go. Next, you need to get 2 pieces of equipment out of the bag that you were given. The bag comes with, this is the suction, where you put the suction. It goes into this spot here, where the arrow is. It clips in and you hear it click. The next piece is where you will put in the saline for the patient. Comes like this, and you have to press it on. Be careful to put it on straight, otherwise it will break. Next, you're going to get your patient ready. Your patient should be on 100% oxygen, and they should never be in a spontaneous mode. What you'll do is the patient will have an inline suction catheter with the suction on it. You're going to take off the inline suction catheter and you're going to put on a bronchoscopy adapter. The adapter comes 2 different ways. It comes either with a larger hole for the adult scope or a smaller hole for the pediatric scope. You will put on for the adult scope, you will clamp it, the patient's still intubated so that you don't have an open circuit, and you'll put it on the ET tube, and then you're ready for the bronchoscope. You'll next get together, you'll need a 4x4 that you'll put some Surgilube on so that the fellow can use it for the scope. You'll need to, at this point, ask the physician what they're going to be doing during the bronchoscopy. During the bronchoscopy, they can either do what's called a bronchial alveolar wash. If they're going to be doing a bronchial alveolar wash, you're going to get 3 60 cc's slip tip syringes. You're going to take the syringe and you're going to gather a 500 ml sodium chloride. You're going to put 40 cc's into your slip tip syringe and draw up 40 cc's. Once you've drawn up 40 cc's, you're going to also add 20 cc's of air. If they're going to be doing a washing, you're going to also need a slip tip syringe, a 10 cc size. The difference is this is a slip tip, this is a regular one that you'll find in the ICUs. These are special for the bronchoscope. You will put saline into your pre-labeled cups. You will add 2 cc's of saline and then 8 cc's of air so that when you inject it, it will be forcing the saline farther into the lung. Next, what you're going to do is you're going to put on your PPE to protect yourself. You will need a blue gown, you will need a set of gloves, and you will need a face shield and a mask. These are required equipment at the Cleveland Clinic. You will put on the mask, and you will put on gloves during the entire procedure, and some gloves. Next, you will make sure that the patient has a bite block in. The bite blocks that are for the bronchoscopes will come in your bag, and they look like this. You can do it one of two ways when you do it. This piece can go over the ET tube, but in order for it to go over, you have to take it off and slip it on and go like this. That's the most secure. The patient's teeth should be at this spot. The other way, if you're unable or the patient's on higher peeps or something, you can cut this and put this on the side, but you need to still make sure that the teeth are in there. Those are the two ways that you can use this. Then, just so I can show you, the reason that you're using these slip tip syringes is when the doctor asks you to inject the saline into the scope, it fits the piece of equipment. You'll go like this, okay? Another quick hint is if they're going to do the BAL, what you need to do is you'll have your 60 cc syringe. You will push the 60 cc, the 40 cc's of water that you have in, and you'll push it slowly. You don't want to collapse the airway, but you will be pushing it in slowly, and when you get all of it in, you then have to start to take the saline back out. You'll be in charge of this part. You need at least 40 cc's after you give the 3 40 cc's of saline to the patient in order for it to be enough for the lab to process it. Once you have all of it, you'll need to label a specimen cup. You'll put all of your sample into the specimen cup, and you'll label it with what part of the lung did you take the BAL or the washings from, and you'll put the patient sticker on it and what part of the lung you'll have. The fellow must hand walk this down to the lab in order for them to process it. In order to clean the bronchoscope, you are going to first have the bronchoscope. You're going to put the rest of the saline that you have in your 500 ml saline, you're going to put that through the bronchoscope, and after that you are then going to get this cleaner, the endozyme, that is included in the bag that you originally got. You're going to open it, and it will come with a sponge inside of it. You'll sponge down this, and then all the blue liquid that's inside of there, you will also suck up from the bronchoscope. And that is a quick review of the bronchoscopy competency.